Imagine the healthcare system is supposed to save lives, but what if instead it often hurts them? Hello, I am Dr. K. Paul Stoller here to outline a provocative case that medicine has become self-serving, bloated, and dangerous, and why millions quietly distrust it. Think of healthcare as a grand bridge meant to carry the sick to safety. Built with noble intentions decades ago, the bridge now creaks with corruption, too many administrators, perverse financial incentives, and a system that often protects itself instead of patients. That's the central argument we'll unpack in 3 minutes. The critics point to a triangle of power: the state, big pharma, and a professional medical establishment that together shape policy, education, and practice. The claim, when doctors become employees of systems and industry funds training, loyalty shifts from patient care toward profit and process. Iatrogenesis, harm caused by medical care, is a core complaint. Examples cited include misdiagnosis, medication errors, hospital-acquired infections, and unnecessary procedures. The accusation: these are not isolated mistakes, but systemic problems amplified by incentives that reward intervention over prevention. Meanwhile, low-cost prevention, diet, exercise, sleep, reduced exposures, is sidelined. Critics charge that the medical industrial complex prefers chronic patients who consume drugs and services, while inexpensive preventive measures are under-supported and under-promoted. The critique covers many targets: crowded waiting lists and deliberate delays, administrative bloat, pharmaceutical influence on research and education, failures in trials and reporting, and alleged suppression of simpler, non-profitable treatments. Taken together, critics say the system is economically and morally perverse. One striking point advocates raise is chronobiology, the idea that when we treat matters as much as how. They argue hospitals ignore biological timing that could make treatments far more effective and less toxic. Whether you accept every claim or not, these arguments demand attention. Greater transparency, fewer perverse incentives, more prevention, and medical care truly accountable to patients. Read widely, ask questions, and press for a system that helps people first, not profits.